I supervise our internal medicine residents in clinic. And the residents are running from their duties on the inpatient medical ward to clinic. And we only give them 5 or 6 patients in an afternoon, so it's not a huge volume. But between the encounter itself, the paperwork that they have to do, or computer work as it were, trying to navigate, you want to make a prescription for a particular medication, you have to check to see which health plan it is and which particular medication is covered versus not covered. There are a lot of inefficiencies that make it very challenging for a physician in training who ostensibly is trying to develop a style of practice that's going to embody the principles of professionalism. It's difficult for them. And so I think as we think about the structure of training, in a sense it's creating physicians who unlearn some of the natural tendencies they have towards altruism, towards investing in relationship, by putting them in a system which basically says, well, there's not really time or space for this, so you learn ways around it. They learn to be very efficient with time, to limit the amount of time they spend with patients, to focus on just sort of check boxes, making sure this is done, that's done, that's done. And most of the things are appropriate things to do, but there's a major shift towards the biomedical, pushing out some of the relational kinds of things that I think patients are really looking for and that would be more rewarding to them as physicians.
In my day-to-day work as the Dean for Medical Education, I deal with medical students who we're teaching the very fundamentals of medical professionalism, and very often that gets translated into behaviors of medical professionalism. And one of the things that I've learned from my students is that if we stay anchored in the behaviors of the professional, the student can miss the bigger picture. They can miss the tenets of professionalism. They can miss the social contract with society. And the way I'm currently working to reframe it with our students, residents, and faculty is to ask them to do appreciative inquiry related to when was the last time you saw someone behaving professionally? Or tell me about the most professional thing you did during your month on our general medicine service. And in that context, I hear the compassion, the empathy, I hear those virtues of altruism and integrity. And so I'm trying to shift the conversation to the conversation of let's think about where in our environment do we see examples of the ultimate consummate professional, and then try to encourage modeling of those examples.
When we say medical school isn't just about accumulating knowledge, it begins to give us space to emphasize those other skills that are equally important. How do you communicate with a patient, especially when you have to deliver bad news? How do you communicate with a patient when they're angry, when they're so frightened they can barely listen to you? We begin to emphasize things like the social context for patients. In my last deanship, we would send medical students not to the clinic to meet their first patient, but we would send them to the patient's home, where they'd really see what the burden of illness was for that patient and their family in their day-to-day life.
If you wanted to have internal medicine residents learn how to truly develop a relationship with a group of patients, a panel of patients, you might, instead of having them see random patients that happen to come in when they come to clinic, you might say, let's give you a group of patients from the first day of your residency. You're going to work with these patients for 3 years, however many years, and give them a profile on those patients, give them some background information so they can begin to learn those patients. That would be a completely different way of organizing medical education, a completely different revolution built around the principles, rather than having a system where we're trying to cram the principles back in to a system that fundamentally is a little out of sync with those. Models like that are taking hold, and in some areas I'm aware of a program at UC Davis where the residents actually are given a panel of patients. So what that means is that resident is going to have a representative experience of what primary care practice might be like, and is therefore going to have a more realistic experience.
I think what we're obligated to do now, we have students who are prepared, we have educators who I think are really giving them some better tools to develop their medical professionalism. I think it's incumbent on us to remove some of the obstacles in the healthcare system now that actually keep them from living up to their full potential.